I'm Diana Royce, Managing Director and Chief Operating Officer of AllerGen NC Inc., which is hosted at McMaster University in Hamilton, Ontario. And I'm pleased to extend a very warm welcome to each of the participants on today's webinar. So welcome everyone. So AllerGen NC is pleased to offer investigators, trainees, collaborators, partner organizations, network advisors, and representatives from our sister NCs and health research networks across Canada access to complimentary webinars on research, knowledge mobilization, and commercialization planning and best practices. This webinar is one of a series that AllerGen is delivering in late 2016, early 2017 with the overarching theme of knowledge translation for research success. We're pleased to have with us today Dr. Melanie Barwick, an internationally renowned knowledge translation specialist based at Sick Kids Hospital and the University of Toronto. Melanie is a registered psychologist and the head and senior scientist in the Child and Youth Mental Health Research Unit at Sick Kids Hospital in Toronto. She's a senior scientist in the Child Health Evaluative Sciences Program of Sick Children's Research Institute and holds appointments as associate professor in the Department of Psychiatry and in the Dalla Lana School of Public Health at the University of Toronto. Melanie is also an internationally recognized expert in implementation science and knowledge translation. Her program of research spans health, mental health, education, and global health sectors. Her research aims to improve the implementation of evidence into practice and to broaden the reach of evidence more generally to support decision-making, policy, knowledge, and awareness. In the field of education and professional development, she created both the Scientist Knowledge Translation Training Program and the Knowledge Translation Professional Certificate offered through the Sick Kids Learning Institute. Melanie has kindly offered to share her expertise with us today, and we look forward to her insights and advice. Welcome, Melanie.
Thank you so much, Diana. It's a real pleasure to be here and to be part of this webinar series. Hello to everybody who has joined today. What I'm going to do is spend about half an hour, 20 minutes to 30 minutes, giving you just a high-level couple of things to think about to introduce knowledge translation to you as a researcher. And it may be something that you have been doing for some time that's already integrated into your research program. But for some of you, this might seem like it's off to the side of your desk and not something that you have considered should be integrated in what you do, not too sure how to fit it in or why you even should fit it in. And so I'm really going to get to build an argument for you about why this is important, why it's important to make this part of your job as a research scientist and to integrate it into your programs of research. So we're really faced with this continuing problem, which is that a lot of the evidence that we produce in our health research, and AllerGen will be one instance of this, fails to have traction. You know, we do our research, we go to tremendous lengths to get grants, get funded, conduct the work, write it up for publication because we want to contribute to the science. We want to share what we've learned with other researchers. And we'll probably, many of us present at conferences, maybe do some individual workshops, maybe a webinar, maybe a conversation or two with a non-academic audience, but maybe not. And so what happens as a result is that research scientists can find your research if they know where to look. But for the most part, much of the research that we conduct in health goes unnoticed. And if it goes unnoticed, it doesn't really have a chance of informing clinical practice, informing policy, or benefiting knowledge users in any way, shape, or form. And by knowledge user, I'm talking about researchers, policymakers, decision makers, the public, consumers, patients, industry, thinking of commercialization pathways. So knowledge user is a term that we use to refer to anybody who is going to be a user of the knowledge that you've generated through your research. So I want to spend a bit of time with you this afternoon describing how this has grown in importance and how it's become more institutionalized so that you can understand the what's in it for me part of, you know, why should I bother thinking about knowledge translation relative to my own program of research. So how do we come to focus on knowledge translation? And I always like to start with a really old story. On the left, you'll see a depiction of Vasco da Gama, who was a Portuguese explorer. And Vasco set off in 1497 with a crew of 160 sailors, of which 100 died. And it was suspected at that time that the disease was scurvy and that citrus was a potent cure for this disease. And what I'd like you to pay attention to here is the dates and sort of the transition from decade to, well, hundreds of years really. So in 1601, Captain Lancaster sailed with 4 ships, and again there was an opportunity here for a randomized trial, really, in a way. So the crew of one vessel got 3 teaspoons of lemon juice. They had 0% mortality and 40% mortality on the other 3 ships. Move forward about 150 years before the British Navy physician James Lind conducted another trial to show that citrus was effective. And again, another 50 years before the British Navy declared citrus to be part of the diet on all Navy ships. It wasn't until 1865, remember we're starting this off in 1497, we're now 1865 before the British Board of Trade adopts this innovation at the policy level due to the adherence and the agitation from the ranks. So if you're quick with mental math, that's 368 years from evidence to policy. Are we doing any better? Well, many would say that we are, but the idea here is perhaps not well enough. Several sources are saying that it takes an average of 17 years for research evidence to reach clinical practice. And, you know, some of that is accounted for in how long it takes to get funded. You know, conducting the research, replication of research. Remember that when we talk about knowledge translation relative to application of evidence in clinical practice, we're talking about bodies of scientific evidence that have been, pardon me, synthesized, high quality, rigorous, repeated research that is actually ready for application. And that's only one aspect of knowledge translation, but I'll come back to that in a moment. So this journey of 17 years includes the replication that we need to do. It includes the dissemination that needs to happen. But it also includes the difficulties inherent with the uptake of research evidence in practice environments. The other problem that we contend with is that as research evidence is making its way through this pipeline, this is a leaky pipeline. Only 14% of this evidence is believed to enter day-to-day clinical practice. And so this would suggest that we could do better in our implementation efforts and working through the system, organizational, and individual practitioner implications of what it takes to adopt new evidence into a practice setting. And so bridging this no-do gap requires us to figure out what are the barriers, what are the facilitators, what are the processes that are required to do this effectively and efficiently, what strategies help to make this happen, what tools do we need, and what is the science of practice change. So the science of knowledge translation, the science of practice change, what does that tell us about how to move forward? Those of you who are working at the end of sort of the innovation spectrum, where you are producing evidence that is ready for application, are going to be tasked with becoming experts not only in their own field of expertise, your substantive content area, but if you want to apply that evidence, you need to also pay attention to the evidence that's coming from the field of implementation science. It's its own science. It's not just a methodology. And so you end up having to be an expert in both. So bridging this gap means innovating in the science of practice change, but I think it also requires us to change how we do our science, how we fund science, and how we recognize the scholarship of knowledge translation. So here are a couple of problems that we run up against when we think about activities for knowledge translation, and in particular practice change, because that's what a lot of us are focused on in healthcare. First problem is we think publication is the road to change. And I think part of that is just falling back on what's comfortable for us. This is how we were trained. We weren't trained to step outside of that box. We were trained to publish and present and then move on to the next project. If we think about publications, if you take a step back and you actually look at the literature, a publication is not really an indicator of impact in terms of what was done with your research. It's more an indicator of productivity. So just look at the information on this screen in terms of the percentage of peer-reviewed published articles that actually are never cited. 55% of the papers published between 81 and 85 that were indexed by ISI had no citations at all in the 5 years after they were published. Imagine if this was groundbreaking evidence that was in this publication that suggested good, strong, rigorous evidence that could ethically be implemented in care to save lives, to reduce costs, to improve quality of life for people. Well, it's sitting somewhere and no one knows about it. And so one of the, the most basic argument is let people know what you've discovered, whether it's for instrumental purposes as yet or whether it's simply just to inform a range of knowledge users. We need to step outside and go beyond just speaking to other researchers. So too many discoveries sit on shelves and in journals and in books. We still need to put them there, and I'm not advocating for no publications, but we need to diversify and look at how other people are marketing their information, because that's essentially what I'm asking you to consider. The second problem is that researchers don't traditionally consider the knowledge needs of clinical audiences or knowledge user audiences, largely speaking. So what are the knowledge needs of the policymaker? What are the knowledge needs of industry? What are the knowledge needs of the clinician who might be at the other end of the spectrum for a disease or a condition that you're studying? What are the knowledge needs of the patients? Knowing something about the knowledge needs of your users will give you some insights as to who to share with, how to share it, what main messages will come out of your research that will be well aligned with the information needs of the knowledge user himself. So just to give you a sense of how to step outside yourself and sort of not just, I'm a researcher, I understand we invest a lot of time in the work that we do, and we like to talk about what we do, and we tend to think that we know what the salient, important main messages are that come out of our research. But we don't always think about what a knowledge user might think is the most important aspect of what we've discovered. So we're going to play a little game, and I know that we're not in a room together, but you'll play along from wherever you're sitting. And the task that I'm going to give you is to imagine that you're in a strange city. You've traveled somewhere, and I'm going to provide you with a document that's based on evidence. So this is your corollary to evidence-based document. And this document is intended to help you get home tonight. So I want you to just take, a couple of milliseconds to have an impression and see what you think of it, and then perhaps when we have a discussion you can share some of your thoughts. But I'll share what other people have said upon receiving this evidence-based document. So here's the document. One of the first things you're going to notice is it's not in English. You can probably surmise that this is a map of a transportation system. If you have traveled, you're worldly, or you're from Japan, you'll know that it's Tokyo. And maybe you can suss out that it looks pretty, it's engaging, that's not irrelevant. You can also see that there are 2 airports. But what you cannot see here, and what is most salient about this exercise, is this evidence does not map onto your knowledge needs as a knowledge user. For one thing, I'm not providing you with information that has in any way taken into account your language preferences, your informational preferences. You don't know where you are on this map or where you're going. That you can even read a map, that a map such as this is the sort of information that you would like to have. Perhaps someone would prefer to have instructions written as a list of turn right here and, you know, go 800 meters up this road, and so on and so forth. So I've made some assumptions here in giving you this evidence-based document, this knowledge translation deliverable, to help you get home, and in fact it's a huge fail for a lot of different reasons. And so when we work through this sort of exercise in a room full of people, people are quick to say that, you know, their impressions are they're frustrated. I mean, of course they chuckle, they think, well, this is ridiculous, but I want you to think about how you are meeting the knowledge needs of people who could use the information that you're producing. Think about format, think about what they need to know, think about what their preferences are, and how they might use that information, even if it's not for instrumental reasons. So in essence, knowledge translation includes sharing information and making sure that people understand the evidence. That's what it fundamentally means. There are some instances where we're sharing research evidence that we want people to actually apply, but that's really the purview of implementation sciences and not something we're going to get into too much right now. So problem number 3 is that we think practice change just miraculously happens. And that is not the case. And in fact, we know that about 70% of health initiatives actually fail. So this is from evidence in the US looking at strategic initiatives in hospitals. And so, you know, we don't do a great job of managing change. And remember that the change that we're talking about when we talk about knowledge translation and particular implementation, it's not quite the same as quality improvement, because implementation involves the new introduction of new evidence into a new setting. It then follows on to be supported by quality assurance initiatives that help to ensure that the new evidence is being conducted safely, that there is still high quality in its use, and so on and so forth. And so it's about that introduction piece that we're not so good at doing. Several years ago, I led an implementation initiative for the province of Ontario implementing a global level of functioning tool or assessment in the child and youth mental health sector. And we were working with 120 organizations in Ontario, over 5,000 mental health clinicians who needed to be trained to use this tool. And when we first got the contract from the government to do this in 2000, we thought it was pretty straightforward. And this might be the way you think about how people will use your evidence. You select the evidence, you train the people, and then voila, change happens. Well, it took a little time, but I realized that it actually looks like this. This is the reality of the implementation journey. And, you know, as you prepare for the journey, you need to think about that preparation, and you need to recognize that you're going to meet all kinds of obstacles along the way before you get to a point of maintaining sustainability, and that ultimately is going to have its own challenges. And so it's not straightforward, and from these sorts of activities and experiences, we have developed a science of implementation to help us better understand the evidence in processes and important factors and strategies that can help us to engineer the change a little bit better, more efficiently, more effectively. You know, the road to change, as I pointed out in the earlier slide, is not straightforward. And success rate for change initiatives is really variable. So on the left, you have the number of people embarking on the change initiative compared to, on the right, the number of people who were 100% successful at implementing their change initiative. This is hard-going stuff, and a lot of the time we abort. We abort the change initiatives for a lot of different reasons, things that have to do with lack of clarity about where we're going. People need to be reminded about where they're going when they change, and they also need to have crystal clear direction about how to get there. They really need to spend a lot of time in preparation, more time than we think. And this is at the level of the practitioner, at the level of the organization, and often at the level of the system, and thinking about what's the relative advantage of adopting this evidence? What's in it for me? What's in it for my patients? What's in it for my organization? What's in it for my system? And so while we're working on how to engineer the change better, part of that engineering comes with how to prepare for change better than we do right now. So this is really supported by some of the facts that have been published in the literature. So clearly, innovation that doesn't get taken up means we have limited benefit to public health, to outcomes. If we don't do this in an evidence-based manner, if we don't do knowledge translation and implementation in an evidence-based manner, it really is slow and haphazard. And the earlier slide showed you that. It's a little wonky, it goes all over the place. We kind of need to manage this better so that we can get to the end game. And that might take 4 or 5 years depending on the scale of your knowledge translation and implementation. So if people don't have the research evidence, they can't benefit. And this is a sort of, again, I want to remind you that knowledge translation is about sharing evidence. That evidence might simply be to change someone's knowledge base, to enlighten them, to shift their attitudes, to prepare them for the eventuality of changing their behavior down the line. It's not always about making a concrete change in their practice, their behavior, or in policy, or even in taking something to market for commercialization. And so if we're not good at this, then we have a poor return on our research investment. We might not feel that as individual scientists because we feel successful. We got the grant, we concluded the grant, we ticked off the things that we thought we needed to do, and we're on to the next one. But really, that's productivity. It's not impact. And so if we can't demonstrate how people benefited from the research evidence that we put out there, we aren't really effectively demonstrating return on research investment. So we're producing evidence. We figure that if we discover it and we write about it, then people are going to act upon it, and that's impact. But in actuality, we need to do knowledge translation, which requires planning. We may need to do implementation if our research evidence leads itself to practical utility, and we need to document what that impact is. So, generally speaking, knowledge translation underpins research impact. If we want to have change out there in the world, whether it's at the level of policy or well-being or health, that's impact, then the activities that we undertake as researchers are what leads to that. It's not just conducting the research. So KT is about dissemination, telling people and making sure you tell the right people, the people who are interested in what you have done, applying, using the best available evidence so that people can benefit. I talk about a couple of terms related to knowledge translation, and it might be a little different from what you're used to hearing. Thus far, I've been speaking for almost half an hour, so I am mindful of my time. I'm going to get there to the end, probably a little 5 minutes over. But what you've been hearing me say is the term knowledge translation and implementation. Well, knowledge translation and transfer, knowledge mobilization, which I believe is the term that AllerGen uses, these terms are often used synonymously to describe a range of activities related to sharing research evidence in a way that people can benefit, and at least sharing research evidence so that they can understand it. All of these buckets, all of these terms are knowledge translation. So think of knowledge translation as an umbrella term. We manage knowledge, which is to say we manage large data sets, surveillance data. We manage knowledge internally in terms of how we communicate within an organization. We have a branch or a subspecialty of KT called implementation science, which has to do with the procedures and strategies we use when research evidence is ready for application. We do commercialization and tech transfer when we take things to market. And probably a term that's fading out a little bit is the term translation research, which has to do with that first translation from basic science to clinical application, the development of a biomarker or a device or something that has application clinically from the lab. So knowledge translation is really the strategies and the processes that make science findings understandable, and implementation has to do with the subset of strategies that promote adoption, integration, and scale up. It happens throughout the whole continuum of science, so bench scientists have more than just other researchers who would be considered their knowledge users. They might have clinicians, industry, venture capital, a range of different people they need to communicate with, and so on. And you can study this slide. We will make these slides available. It includes thinking about how to bring research evidence into clinical practice and beyond. So implementation research is about how do you scale that up to populations, to whole organizations, to jurisdictions. The other language to think about is sort of impact. So how do you gauge impact? And for me, impact is either an indicator or a story that tells you or shows you that people knew what to do with the knowledge you shared. And so it could be something soft. It could be something that you track in terms of informational needs of people. And it could be things like spread or perceived quality, perceived utility, intent for behavior change, those kinds of things. David Phipps talks about understanding impact as being measured at the user level. And so he provides this distinction between research impact and knowledge translation impact. And so at the level of knowledge translation impact, we're looking at the contribution that your individual research makes for a range of knowledge users and a range of KT goals. So what's the relevance of knowledge translation for you as a researcher? Well, it's about communicating. And, you know, I did my training, my PhD in psychology at McGill, and nowhere was there any training or any talk about the term knowledge translation or any training in sort of how do you communicate your research findings beyond teaching, presentation, and publication. And so this is a whole new area that we need to blend into the work that we do. But consider that your science is going to be judged by a range of impacts. Yes, your grant funding and your publications and your H-index, but also your collaborations, so your recognition internationally and nationally, and your impact on science, practice, industry, and health. So for those of you who are familiar with the CIHR instruments, the Common CV, the final report, you'll know that there's a section in the Common CV that asks about your knowledge translation activities. Those of you, it may have been some time since you've done a CIHR final report for CIHR funding, but don't be surprised, I'm giving you a heads up now, that there's a large, huge section on knowledge translation activities to report on for your CIHR funded grant. You can actually find this document as a PDF on the CIHR website, final grant report. It might be called, and I'm happy to share it with Marshall and he can distribute it since it's open and out there. But have a look at what they ask you for, and so this is really important to know at the beginning of your research project when you're writing your proposal. It might also be important for academic promotion. At the University of Toronto and the Faculty of Medicine, we can go forward for promotion on 3 planks: research, teaching, and something we call creative professional activity. And creative professional activity really sort of takes into account community engaged scholarship, knowledge translation activities, and there are assessment criteria as well for documenting its scholarship. So it isn't just I did this, it's I did this and here's the impact that this had on policy, on practice, on the community, on healthcare. So it's about documenting that. People need to find your research in order to read it. So it has to be clearly communicated. People need to understand it. We've all been to rounds, different professional talks. We all have PhDs and MDs. Many of us are highly educated. We oftentimes may not understand what that person's talking about because there's too much jargon. It's not plain language. We need to think about plain languaging. And plain languaging is not dumbing down. It's making sure that you use clear language to communicate a concept, an issue, your findings, and it's easy to do and it's important to be doing this. You need to make your stuff interesting enough to read it when they do find it. And so the research publications stand on its own. People are going to look for it, find it, and read it because they have a vested interest in knowing what you've done so they can contribute to their own work. When we produce knowledge translation deliverables that look different, that are tailored to different populations, infographics, plain language summaries, reports, webinars, we need to make sure that they're interesting and captivating, that they're plain language, that are easily digestible for people. And the main messages and the implications of what we share need to be evident. So you have to plan for knowledge translation for these knowledge users in order to get there. and track your impact so you can report on them in the common CV, in your performance evaluations, in your final reports, etc. So translating your research means recognizing who needs to know, developing skills for communication, and this might not be things that you're going to develop in and of yourself, but you can build research teams that bring these KT activities within the research team. Planning for KT, tracking benefits, and reporting on your discoveries. So I've alluded to this earlier, but this slide sort of captures this notion of knowledge translation goal. Because we have a tendency to think that knowledge translation is always about application, this slide reminds people that we have different KT goals, and the KT goal needs to be really evident. It's sort of the same as saying, what's your role, what's your reason for communicating? Are you trying to generate awareness? Are you trying to share knowledge, inform research or decision-making, change practice, policy, etc.? And the boxes that have the little check mark are sort of the purview of implementation science. That's where we're going to look at the subspecialty of evidence in this subfield to guide us on the evidence on how best to change practice. But just to be clear, knowledge translation doesn't need to occur solely on large bodies of evidence. We do this when we finish a grant. We publish a paper. That's knowledge translation. We give a talk. That's knowledge translation. So being clear about your goal and developing a plan that maps onto that goal, evaluating against the goal, is a great way to go. So to help people do this, some years ago in 2008, I sketched out a knowledge translation planning template that sort of walks you through the components of knowledge translation planning. Identifying who your project partners are, when you're going to engage them, what their roles are going to be relative to the research and relative to the knowledge translation activities, what KT expertise you might need on the team. You might not need a whole heck of a lot, but you might be doing really participatory research that's very integrated in its knowledge translation activities, and you might need to stretch yourself there. Who are your target audiences or your knowledge user audiences? What do you anticipate your main messages are going to be? And of course, you know, that's going to morph and evolve over the course of doing your research, but you're going to have some idea of the kinds of things you're going to tell people at the end. And then what are your knowledge translation goals? What strategies are you going to use that will help you attain that goal? What process is going to dictate your plan? Is this just an end of grant knowledge translation plan, or is it end of grant and integrated, which is to say you are really working collaboratively with your knowledge users throughout the life course of the research project, so that means that you are continuously sharing knowledge with them and building that knowledge with them. And with what impact? So how are you going to evaluate the success of your KT plan relative to your KT goals? If you're going to use a webinar with nurses to inform them about new evidence in pain management, and you're developing this because essentially what you want to do is share new evidence, build awareness, and give them some new knowledge, how are you going to evaluate that the webinar, your KT strategy, was effective in doing that? That's useful for you to know because you made an investment in that webinar, both in terms of time, resources, etc. And your goal of really impacting and moving your research out to groups of nurses relative to pain management is your impact. So what are the indicators going to be of how successful you were? What resources are you going to need to budget for, and what budget items can you foresee? And if you can do this template while you're doing your proposal, you can actually integrate that into many sections of research funding opportunities now. And many funders will also allow for KT budget activities. So AllerGen allows for this, CIHR allows for this, many other provincial research funders also do so. And then thinking about how you'll activate your KT plan or implement your KT plan. So what's really going to happen? One of the biggest mistakes I see in people's KT plans when I review research is that it's not aligned. There's a paragraph that identifies knowledge users, a separate paragraph that identifies KT strategies. They don't align with each other. There's no identification of a purpose or a KT goal, and there's no mention of how you're going to evaluate whether your KT plan was successful. So in my mind, that's a big fail. You can pull the training template, the template off of my website, and the link is there at the bottom. So we have some drivers for improving knowledge translation already in our system. We're building scientist and clinician competencies for KT. We have 2 training programs that we offer here at SickKids. One that travels, which is a 2-day scientist knowledge translation training program intended to help scientists think about this and incorporate and build new skills. The other is a knowledge translation practitioner certificate program, which is for knowledge mobilizers. We're developing KT capacity internally in that way by developing capacity for organizations to have individuals that can help scientists and others in the organization with KT. Funders are changing their criteria to embrace and fund KT. Academic institutions are changing their promotion criteria to adopt promotion criteria that recognize the scholarship of the knowledge translation practices that researchers engage in. And a lot of funding opportunities and organizations are thinking really innovatively about how they can integrate research with clinical practice right at the beginning. So I'm going to stop there, 40 minutes in, and I want to make sure that there's time for questions. This is just a slide talking about many of the other areas of work that is happening in the field of implementation science in terms of developing reporting standards, testing out strategies, measuring important constructs related to implementation. So there's a lot of work going on globally in this field. Some other resources that might interest you, e-learning modules, and in fact we have 2 e-learning modules we're just about to launch from the Learning Institute here at SickKids that support the knowledge translation planning template. And I will share that link with Marshall, and he can share it with all of you once it comes out by the end of this month. It basically walks you through how to use the knowledge translation planning template, and it's just a helpful support. Some educational videos, where to find the planning template itself, and we have a knowledge translation game that teams are using to work through knowledge translation planning with their research teams. Just a bit of information about our Scientist KT training, and done a lot of them, 88 and climbing, so this is something I've been doing for the last 14 years. And then our Knowledge Translation Practitioner Certificate, which is really international. We're quite a draw internationally, and that's really exciting. The last thing to mention to you is our Global Implementation Conference, which is occurring here in Toronto this June, with our pre-conference academy of long sort of half-day workshops in implementation science and a main conference of 2 days. So please have a look at our conference website and sign up. Abstract submission and acceptance has already passed, but we certainly would be happy to have you join the conversation about implementation, and this is multidisciplinary, multi-role conference, not just researchers. So that's it for me. Sorry for going over time a little bit. My contact information about the training opportunities. If you're interested in training, please contact me. And I'm happy to take some questions and to open it up for discussion. Thank you for your attention.
Well, Melanie, thank you for this highly contextualized overview of the ways in which knowledge translation will enrich our research initiatives and amplify the relevance and impact that they can have. This was also very valuable in terms of the introduction that you provided to a number of tools by which scientists can efficiently integrate KT into their research plans and projects along the way. I have to say your experience and expert knowledge and your passion for this subject matter is both impressive and inspirational. So at this time, it's my pleasure to open up the floor to questions from the webinar participants. So I encourage all of you to take advantage of Melanie's availability to seek her advice on the challenges you may personally be facing when it comes to building KT into your research plans, or if you're a knowledge broker, in coaching your researchers to follow some of the strategies that Melanie identified in her talk today. As we noted earlier, you're presently on mute, so to ask a question or join the discussion, you will need to use your control panel to raise your virtual hand in order to speak, or you can submit a written question. So we'll take your questions in the order they're received, and if you've raised your hand, Marshall will announce your turn and unmute you so you can speak and be heard by all of us. Marshall, over to you.
Thank you, Diana. We have one question already. I'll read it out. It's a written one, and I apologize in advance for mispronouncing any names in the process of the Q&A. So this question comes from Joanna Mendel, and she writes, "Thanks, Melanie. I'm wondering if you have any good resources or models for evaluating integrated knowledge translation specifically before results are available."
That's a great question. Thank you, Joanna. So one of the ones that I have used before, although I didn't conceptualize it as a measure of integration, but more a measure of collaboration. And I think if, obviously there's some overlap between collaboration in a group of people and what we're calling integrated KT. So this is a measure that was developed by Ireland Public Health. It's the Partnership Evaluation Tool, I think it's called. And if you email me, Joanna, or through Marshall, I can send you the link. And what's really nice about this is it's a tool, it's a questionnaire-based tool that you can use with your group. So whether it's your integrated KT research team or a community of practice or a working group of some kind, this questionnaire does two things and conceptualizes collaboration in terms of expectation and realization. So the first questionnaire gets submitted to everybody, and it asks questions about what people's expectations are relative to the learning that will come out of this, the actions that will come out of this, the connections that will come out of this work, and the impacts that will come out of this work. So they've sort of factor analyzed the questions in the questionnaires to map onto those 4 domains. And so you get everybody's sense of, what their expectations are coming into this collaboration. And then intermittently, so as a repeated measure, you can use the second questionnaire to get at what was actually their experience relative to those 4 domains. So what did you actually experience about learning, connection, actions, and impacts? And you can map that as sort of a spider diagram, so you can see, well, people's expectations were really high for connections, but what they're really experiencing is a 2 out of 5, not a 5 out of 5. And so you can self-correct. You can also talk about what was achieved in your collaboration in a way that gets at more than, we pulled in these types of people, we had this number of meetings, we produced these deliverables on schedule, which might be important indicators, but it sort of gets more at the nuance of that collaborative relationship. So that's one that I've used in the past in a project with Catherine Boydell some years ago, looking at working group tables for the Toronto District School Board. And it was fairly easy to use.
Great. Okay, we have a comment and 2 questions from another participant whose name is Raisha Fernandez. Again, apologies for any mispronunciation. First her comment and then 2 questions. Hi Melanie, great presentation. I look forward to the e-learning module. Our class is currently using your KT planning tool for our separate KT projects. And then the questions. Number 1. Do you have any advice for planning for the time it takes for a KT project when you have deadlines? As we've learned that it really takes a lot of time and a lot of back and forth communication between partners. Mm-hmm. That's question 1. Do you want me to read question 2 right away or hold back?
Sure.
Okay. Question 2. Okay, great. Question 2. Any advice on how to evaluate the impact of written KT deliverables? For example, pamphlets, printed infographics, or posters, etc. That's it.
Okay. So I'll address the first question first. So, how do you do this given that it's a time hog? And it is. And not so much for everybody, I think we need to appreciate that for the range of science that is being conducted in any NCE, so from basic to clinical to health service and maybe even some population health science, people will have different KT plans, and that's as it should be. Some will be full-on, some will be relatively tight and short. So it's really, developing a plan that's appropriate to your aims and to sort of where you're situated on that continuum. Time is really, the biggest barrier for anything. Any study that's ever been done about barriers always comes up with time. I think some of your sort of efficiencies will depend specifically on your project, and we don't have time to sort of get into the nitty-gritty of your project. I would say one of the time-saving things would be to do a KT plan, sit down, take the time to do a KT plan, figure out who your knowledge users are, what activities you think will map on to your knowledge translation goals and the messages that you have to share with whom, thinking about who your knowledge users are, and think about whether there are partners, strategic partners you can pull in that can build some efficiency for you. So let me give you an example. Some of the research that we did in pain, this is the work of Bonnie Stevens here at Sick Kids. One of our things we wanted to do, as I alluded to earlier in an example, was to share research evidence with nurses, and we decided we would do webinars. Well, rather than cost of the time and the resources and the technology of running the webinars ourselves, we reached out to the Canadian Association of Pediatric Health Centers to partner with them just around that piece, because they have a knowledge network and they have webinar capacity, and they also have a manager who takes care of that. So that all immediately reduces time and cost. If you can think about what sorts of things you would want to do and where can you go to partner up to get those resources without having to build them into your team. The second strategy would be to actually build them into your team. If there's a lot of knowledge translation that's going to occur in your project, who's on your team that has some knowledge in this, who's maybe taken the scientist KT training or the KTPC, who has this in their head, who's going to take that on, who will be the point person for main communications. And efficiencies will also occur if you can project manage it, and you can only project manage the KT if you have a plan. So whether you want to call it a plan or a logic model or what have you, it needs to distill down to a series of concrete actions that map onto goals and timelines for those, and costs and resources and partners that are going to help you with them. So, there's going to be some aspect of the talking to people, getting to know people, interacting with people that will always be, time-laden. But that's important work, and it's not to be diminished, and it's not to be taken lightly, because those are, the more engaged and the more buy-in you can have with your knowledge users at the beginning and throughout your work, the more likely they are to use your research evidence to partner with you again in the future, and that you're actually going to have an impact. So it's a good investment of time. Resha, relative to your second question, so how do we evaluate impact for posters and infographics? I can't stress enough that the key to any kind of evaluation, whether you're talking about KT or project evaluation, is to start with an aim, an objective. And when you're talking KT, it's what I mean by your KT goal. What we often do is we pick out our main messages and we decide, oh, I'd really like to do an infographic, or maybe I'd like to do a webinar. Or whatever the next, maybe I'll just do one of those whiteboard animated videos because they're just so great right now and so hot. Well, back up, because those things are expensive and they take time, which harkens back to your first question, and think through what's the goal of sharing a particular main message with a particular group of knowledge users. What are you trying to accomplish? Then pick your main message, and then pick your KT strategy in a way that suggests, if there is some evidence, that it's useful for that purpose, but that it's at least an evidence-based approach. Maybe it won't be, but here's your opportunity to evaluate it and add to the knowledge base by maybe a paper you never thought was going to come out of this research grant. So start with your knowledge translation goal. If your infographic is intended to be shared with the public and decision makers, infographics tend to be shared with a range of knowledge users. One of the things you're going to want to know is spread. Who actually saw it? How did you get it out there? And what are your analytics for who actually downloaded it? Now, downloading something is not an indicator that they actually used it or that they thought it was of high quality. And so again, this is going to depend on what you want to know. If you want to know whether your infographic informed policy or informed practice or shaped their knowledge, you're going to have to come up with some quick and dirty ways to get people to answer questions about it. And you know, that could be a pop-up survey, that could be a link on the infographic. You know, you're going to get a purposeful sample. You're not going to get a representative sample, but you may get enough people commenting back on how useful, what their intent is to do, to share with the product that you developed. And so thinking it through from the get-go is going to help you get there. And you can manage your expectations in that way as well, in terms of, well, we can't do a full-on evaluation, but we might get a sense of spread. We might get a sense, at least for some people, about whether they thought what we shared was useful and how they perhaps intended to use it. Another thing that you can track on Web Analytics is when people email or tweet about your KT deliverable. Well, if they're going to bother doing that, and you know, I'm saying this quite loosely, but if they're going to bother sharing it, they must think it's useful or would be useful to their group of people with whom they're sharing it. So it's a bit of a proxy indicator for value, and I say that kind of lightly. But so start off with a plan, evaluate based on what your KT goals are, and pick your strategies based on what your KT goals are.
Great, thank you. We have no other questions at present. A couple of expressions of gratitude and an expression of interest in the link to the partnership evaluation tool, but no questions.
Okay, great. Well, thank you, everybody. Happy Valentine's Day to you all. I'm happy to share an hour with you.
Well, thanks, everyone, for attending and for your thoughtful engagement with today's speaker. We hope the content of today's discussion was useful for everyone. Please let us know how you feel about this webinar. Immediately after we close the session, you'll be prompted to complete a brief survey to provide us with your feedback. It should take you only a minute or two to respond, but your responses will help us plan for future webinars. Speaking of that, this was the second in a series of AllerGen webinars on knowledge translation, and we very much hope you'll be able to join us for at least some of the others that we have lined up for the balance of this year. Again, I thank you all for participating in this AllerGen webinar, and I give special thanks to our presenter, Dr. Melanie Barwick, for an excellent session. I hope to be with you all again in this same space next month. We'll see you soon. Thanks, everyone. Bye-bye.